Hello, my name is Sarah Crum. I am presenting my PowerPoint on theoretical framework to support evidence-based practice. The healthcare systems model by Betty Newman is a model for healthcare providers to recognize that people are unique individuals and appreciate that they have an internal and external stress. The ultimate goal for providers is to reduce these stressors that people feel, therefore creating the best possible environment for the best possible outcome. This presentation will discuss Betty Newman's healthcare systems model, describe the issues of postpartum depression in refugee migrants, and how to apply Newman's model as a framework for this issue as an evidence-based practice. Betty Newman's healthcare systems model is a general theory that acknowledges how each individual interacts with their environment and other individuals, thus creating a client system. Newman describes that a client system can range from the individual all the way to a larger group setting. These systems can influence both positively and negatively when it comes to the individual's healthcare management. Newman further elaborates by saying there are 5 characteristic variables that a human being has. These variables are developmental, physiological, psychological, sociocultural, and spiritual. Developmental variables can be described as the age-appropriate markers that were met or not met while growing up. Physiological is the performance and structure of the physical body, while psychological variables allude to mental developments as one interacts with the environment. The influence of culture and other social stimuli refer to the sociocultural variable, and the spiritual variable represents a person's belief system. The variables are what impacts each unique client system and influences how the individual seeks and responds to medical care. In addition to the variables and the client systems, Newman further dissects the human being to say that we all have a central core function of survival mechanisms that include body performance and ego. At this level, external and internal stressors can create a systematic response within a person. Within the individual, there are further factors that must be taken into account. These factors include intrapersonal, for example, conditioned responses, interpersonal, such as role expectation, and extrapersonal factors. And these are external stimuli that include things like financial stressors. The ultimate goal of this theory is reducing an individual stressor by the use of nursing interventions. In order to achieve this goal, there must be an assessment of perception on both the patient's thoughts behind their care and the provider's understanding of the patient as an individual and whole person. As a nurse practitioner pursuing women's health, postpartum depression is a major concern in the community. Postpartum depression is defined as a depressive occurrence that can take place up to a year after delivery. According to the CDC, 1 in 8 women experience postpartum depression, and depending upon what region, it can be as high as 1 in 5 women. Culture can influence multiple aspects of postpartum depression. As people immigrate to high-income countries, there can be a culture shock. This culture shock trickles over to women that are going to give birth thereafter. There is an incidence of 2 to 5 times more migrant women that develop postpartum depression than non-migrant women. This can be attributed to a multitude of factors. Some of these factors include the nature of their migration, i.e., was it forced? There are personal cultural concepts, there's mental health stigma, social support or lack thereof, and health-seeking behaviors of these women. It can be seen in pregnant migrant refugee women that the client system that Newman describes can allude to the larger group. Women in this situation have all 5 of the characteristic variables of the healthcare systems model. However, there can be more of a strain on the psychological, sociocultural, and spiritual aspects. These challenges refugee women face can induce a more stressful situation for the postpartum period and can lead to postpartum depression. The stigma behind mental health is not just reserved to the Western society, and therefore some cultures describe postpartum hemorrhage as being tired or bored. On top of the stigma, many cultures traditionally support the pregnant women by other women in their group. However, this can be grossly interrupted by the need to migrate. Ultimately, this all creates stress on the new mother. The main principle of Newman's healthcare system model is the reduction of stress for the patient. Using Newman's model, we have learned that we are all unique humans with both internal and external stressors. Knowing this, refugee migrant women in the postpartum phase of their life can be faced with an amazing adversity. Putting this model into practice for this population would take a great amount of assessment and education, with the end goal being the reduction of stress. Trust will need to be built by way of asking questions to the patient, with an interpreter's help if needed, fully listening to her concerns, and creating a compromise plan of care to ease the pressure that she is feeling. Differences in culture will be a challenge. This is why we need to ask what psychological, sociocultural, or spiritual burdens that they may have about how they're feeling after giving birth. When these internal and external stressors are identified, a plan of care can be initiated in a collaborative fashion. Throughout this presentation, we have discussed Betty Newman's healthcare systems model and discovered that we are all unique entities with different internal and external stressors. As a nurse practitioner focusing on women's health, I have noted postpartum depression as a concern, more specifically to women of different cultures. Using the healthcare systems model, I discussed how to integrate this model into treating postpartum depression in migrant women, with the ultimate goal of stress reduction of these women.